Going to the doctor for sexual and reproductive health needs can be a bit anxiety-inducing for some students. Here's what you need to know about gynecology at UNC's Campus Health. First off, gynecology is not just for women. Providers in gynecology are trained in the specific needs of people who identify as women or who have any of the following body parts: ovaries, a cervix, a vagina, or a vulva. The most typical reason people visit gynecology is for an annual wellness checkup, which is also called an annual exam. These visits should happen every year after you turn 21 and are provided at no charge to UNC students eligible for care at Campus Health.
An annual visit to a medical provider helps your provider know about your current health concerns and prevents any future health needs. This visit usually includes a conversation about your medical history, sexual history, and current practices. And if indicated, the visit can include a breast exam, Pap Smear, STI Testing, or a pelvic exam. Remember, annual visits to a medical provider are recommended for people of all gender identities and sexual orientations. You should plan for the visit to take 30 minutes. Many students told us that knowing what's going to happen at an appointment makes them feel more comfortable. So let's get into specifics. Breast exams are provided to monitor changes in breast tissue and detect breast disease if present. A healthcare provider will carefully feel your breast tissue, looking for changes or abnormalities such as lumps. The provider will also visually check your breasts while you are sitting up and also while you are lying down. Pap smear guidelines change, but most people with a cervix do not need them every year. The purpose of a Pap is to look for abnormal cervical cells associated with cervical cancer or cells affected by human papillomavirus or HPV. A Pap smear is performed using a speculum, which is inserted into the vagina so the provider can see and access the cervix, where they will collect cells using a small brush and smooth spatula. The cells are then sent to a lab for testing. Your provider will contact you with any abnormal results. A pelvic exam is used to evaluate the size, shape, and consistency of the cervix, uterus, or ovaries. This will not always be done at each annual visit. A pelvic exam usually comes after a Pap smear. The provider will remove the speculum and insert 2 gloved fingers into the vagina. The provider will locate the cervix and use another hand to press on your abdomen. This should not be painful, but you might feel some pressure during the pelvic exam or the Pap smear. STI testing may or may not be recommended. If you decide to be tested, tests may include an extra swab of the cervix during your Pap smear to collect cells, a swab of vaginal wall cells that you collect yourself, urine samples, blood tests, or oral swabs. Talk to your provider about what tests are right for you. Some testing may not be covered by your health insurance, so call your insurance provider to discuss what is covered before you visit Campus Health. Learn more about STI testing on our website. P.S. You might be in a situation where finding a consistent method of contraception is to your benefit. There are many factors to consider in finding a birth control method that works for you, and lots of methods that exist. We made a whole other video to tell you more. Just one more thing. To save yourself time, fill out the initial physical form located in the form section of our website before your appointment and bring it with you when you come in.
Ready to make an appointment? Call or make your appointment online.